In this video, I will explain anatomy of calcaneus bone, its site determination and its important features. This large bone is called as calcaneus or calcaneum. Calcaneus is the largest bone of our foot. Above it articulate with talus bone and superiorly or in the front it articulate with cuboid bone. It has 6 surfaces: superior, inferior, medial, lateral, anterior and posterior surfaces. Let's discuss these surfaces one by one. Its anterior surface. Its anterior surface is short and it has an articulating surface for articulation with cuboid bone. This articulating surface is for articulation with cuboid bone. Its posterior surface, this one is its posterior surface. Its posterior surface is very large and it forms prominence of heel, and it has an tuberosity, large tuberosity. This one is large tuberosity of calcaneus bone, and it gives attachment to tendocalcaneus. Superiorly, calcaneus bone has 3 articulating surface. This small and anterior one is called anterior talar articulating surface, and this middle one is called as middle talar articulating surface, and this third and large one is called as posterior talar articular surface. All of these 3 surfaces are for articulation with talus bone, and between this posterior talar and these anterior one articulating surfaces there is a sulcus or groove which is called as sulcus calcanei. This groove is very important. And inferiorly it has 3 tubercles. This large and anterior one is called as anterior tubercle, and posteriorly it has 2 tubercles. This large one is called as medial tubercle, and this small one is its lateral tubercle. And its medial surface, and most important feature of its medial surface is shelf-like bony projection which is called as subtentaculum tali. This shelf-like projection is subtentaculum tali. And its lateral surface. Its lateral surface is flat and it has small bony elevation which is called as fibular trochlea or peroneal trochlea. This trochlea separate fibularis longus and brevis muscle, and below this trochlea there is a groove for tendon of fibularis longus. And if you know all of these features, then its site determination is very easy. Its anterior surface is small and has articulating surface, while its posterior surface is large and it is very rough. And its superior surface can be recognized from these 3 articulating surface, and its inferior surface has tuberosity, and its medial surface can be recognized from the subtentaculum tali, whereas its lateral surface is flat and it has fibular trochlea.